Okay, we are rocking and rolling. Have fun, guys.
All right.
Do you edit this yourself?
I do, and it's fun. I really enjoy videography. So, brothers and sisters, ladies and gentlemen, I want to introduce you to a great friend of mine, a man that I met about 10 years ago, a man that I met after studying his material for about 3 years. I was very astounded to learn on some of these Christian Christian television stations that there was a man actually talking about health issues from a biblical and from a scientific perspective. Very unique, very strong ministry. He doesn't necessarily call it ministry, but that's exactly what it is, because the way the Lord is using this man to help so many people with knowledge. You know, the Lord said, "My people are destroyed for a lack of knowledge." I'd like you to meet Mr. Doug Kaufmann. Mr. Doug Kaufmann is host of the television show Know the Cause. So we're going to get some good information on today. I'm hoping you're ready for it. Is that all right?
Let's see, 10 years ago, that would have been a dark-haired Doug Kaufmann. What happened?
Yes.
I got white hair on you. But still doing it, David. Isn't that amazing?
That
we
is
are in our
amazing.
22nd consecutive year
Yes.
on television. We never thought, talking about fungus,
Right.
Monday through Friday for 30 minutes had a 22-year stretch. And I don't think we're done yet,
No way.
because science is finally catching up to us.
Yes. What has it been like for you over the years when you first began your journey? You had your own health issues that you were discovering the fungus to be the cause of. Can you kind of walk us through that process a little bit?
I'm one of these guys in college, 18 years old in California. One day I get a draft notice. Now that was during the Vietnam War. That's a scary thing to get. And to make a long story short, I discovered that I wouldn't have to honor that draft notice if I got out real quickly to the Air Force, Coast Guard, Navy, anything to go, rather than going to Vietnam with a gun in my hand. The Navy took me, and off I went to Vietnam. They train you for a couple of years. You go through some schooling and then some rotation internships in various wards. So for a year and a half, 2 years, it's kind of like nursing school when they used to have a 2-year degree. And they train you specifically in emergency medicine. You are the Marine Corps, U.S. Navy corpsmen are the Marine Corps liaison to healthcare.
I see.
We carried morphine and IVs and everything in our packs, and off I went with the 2nd Marine Division to Vietnam in 1970-71. When I came home, David, you now have known me for quite a period of time.
Yes.
There was a time when I came home in 1971-72, I was working with a doctor friend, Dr. Everett Hughes at USC Medical School. He was on the 9th floor of the tower. And if anyone else was on that elevator going up to the 9th floor, my heart would beat out of control. I would sweat. I had stomach problems. The skin on the folds of my arms would bleed. And one day Dr. Hughes said, "Well, you were in Vietnam." I was telling him these bizarre symptoms I was having.
Yes.
"You were in Vietnam. Did you ever eat raw fish?" And I got, "Raw fish? Yeah, we had some raw fish, tuna fish and so forth." And he said, "I'll bet you have a parasite." Look, I'm willing at that point to do anything. I was feeling so badly. And I discounted post-traumatic stress. You know,
Okay.
I mean, we all saw things as a 20-year-old kid we probably shouldn't have seen, but I didn't think it affected me that way.
Right.
So I'm reading this book. Here's the way God works in my life. I'm reading, it was either a 1953 or 55 medical textbook called Parasitology. And I get up and I run over to the, now we didn't have, "Hey Siri, look up parasites."
Exactly.
You know, we had to get a library card, and I went off the library and got it, and after hours, lay the book on the counter, go off to the men's room, come back, and the book had opened to chapter 11, which was yeast and fungi parasitizing humans. I had this horrible jungle around my arms and my legs.
Yes.
I knew that was a fungus. Could that have transdermally gotten into my bloodstream? I know it sounds bizarre, especially 50 years ago, but in fact, I think that's what happened to me. So I thought, after a lot of study, that I was the only guy that had a systemic fungal infection. And the book also stated that fungi thrive in the presence of carbs. Well, I'm a 21-year-old guy living in LA, so is Coors beer and cookies and, you know, no salads, no healthy food. And so as Dr. Hughes had said, "Have you changed?" You know, because continued on these bizarre symptoms. I said, I sure have, Dr. Hughes. I went from Oreo cookies to chocolate chip cookies. I went from Coors beer to Budweiser beer. You know, the way we thought back then is the way many people think today. I'm just going to change my sugar.
All right.
So eventually I decided, I tried an anti-fungal drug that a doctor gave me called nystatin. I developed what is today called the Kaufmann diet. It's a diet that stops feeding fungus.
Yes.
And between those two, David, I started to feel normal again for the first time in maybe a year or two. So it wasn't post-traumatic stress. In my case, it may be in many of our brave men and women who have fought in wars. But in my case, it was a yeast that I brought home, a fungus that was living on me, and that was contributing to very strange symptomatology.
If I recall the story accurately, you kind of gave this information to the doctor you were working with at the time. How did he respond when he saw that the change in diet and the direct attack, I'll just call it an attack, on the parasite within your body? You're doing two things. You're starving the parasite, the fungal parasite that many of us don't believe we have.
Yeah.
And you're also taking direct steps to shut it down, to kill it, giving the body what it needs to activate the immune system so that the body goes after this thing, recognizes it for what it is, and goes after it. How did your doctor? Yeah. Because he wasn't trained that particular way to deal with the fungal infections, right?
Right. Okay. So Everett Hughes was a PhD, wasn't an MD. He is one of the most brilliant men I've ever had the honor of working with. But my time with him was short-lived. We were working on a joint venture research paper on something called ADHD. Was the etiology food? We were doing food allergy testing and so forth. But I was only there short-lived, maybe 4 to 6 months total.
Okay.
So I was kind of on my own. I kind of had to experiment. Now, I was a 21-year-old guy who didn't want to give up my Mexican food. I love, Mexican food. I love beer. It calmed me, the savage beast. It slowed down. So on weekends, because I worked at a hospital, on weekends, my roommates and I would go have a beer or two. And we'd eat some peanuts, and we'd eat some candy, and, do everything 21, 22-year-old guys do. Saturday, I felt horrible again. This started bleeding.
Oh, my.
And so I'm not a genius, far from it. And it probably took me, 2 or 3 months before I saw that cause and effect relationship. If we're growing, and I've written a book on cancer being intimately linked with fungus, if we're growing a lump on our neck and we change our diet and that lump goes away, praise God.
Yes.
It's not that easy when you're trying to demonstrate a cause and effect relationship between these fungi, unlike bacteria, and the symptoms we have. But I've written 13 books on this now. I've been at this field 50 years. I've lectured to groups of doctors on neurological complications induced by fungus, cancer induced by fungus, and so forth. So I've learned a lot, but all the while, Dave, I felt I'm all alone. And I'm teaching now on social media and on television in 500 million households. I'm teaching people you're gonna kind of feel alone.
I do see.
Because your doctor doesn't know about this. He is he or she, wonderful, twice my IQ. But if you don't teach fungus in medical training, and they don't, now vaginal yeast, ringworms, stuff like that.
Okay.
But if you don't teach that the lungs can be impregnated with this and mimic lung cancer, well documented in the scientific literature, that breast cancer is sometimes fungus, well documented, no breast cancer specialist looks for fungus in that lump. If you don't teach that, and then you don't teach nutrition, you've got a physician who is a Band-Aid physician. Let's put you on this Band-Aid or this Band-Aid or chemotherapy. Why ruin the whole body when the problem is right here in the breast? So that's pretty much what I've done the past 50 years, and we have a growing audience.
Well, two things that I want to kind of conclude with here, because you've really helped us understand some things that it's not spoken of very much in the general media. Standards of care. I want to deal with standards of care, and I want to ask you about what you have seen in the way of people becoming more and more aware. I'm talking about the general world, the people at large. And especially with what the FDA has done recently in the way of acknowledging that fungus is a cause that needs to be considered. They're finally acknowledging it, but you've done how much research? You've done how much? In other words, you have blazed a trail in that regard, and it's not that you're looking for any accolades or anything in that regard, but you know, in the old school days, we used to have to prime the pump.
Right.
Oh, we would have to prime that pump
Good
so
analogy,
hard. You
good
know what
analogy,
I mean?
yeah.
And you're just waiting for the flow to start. When is the flow gonna start? Are you seeing that kind of change? Are you seeing that kind of change? And then I also, if you can also just speak a little bit about these federal laws that are in place as standards of care as to what a doctor can and can't do in the way of providing treatment.
Really good questions, thank you. Number one, I'll speak in vague generalities. Standards of care are decided by a group of doctors. Unfortunately, many times those doctors have their wallet being filled by a pharmaceutical company.
Okay.
Now, I call that cheating. I don't think that's fair. If you're receiving money from a pharmaceutical company, then statins are the darlings for you. If you're not receiving money from a pharmaceutical company, maybe niacin, one of the B vitamins, maybe an exercise program, might accomplish the same thing. Two standards of care. If you and I are in a car wreck today, and we both break our arms, I like those standards of care. But a panel of 10 people have said, okay, you're going to go to an emergency room, you're going to have an x-ray shot of that so we can see what kind of break you have. We're going to put a cast on that. We're probably going to give you pain medicine. We're going to tell you to elevate. I like those standards of care. That's where we shine in America. Now let's talk about cancer. The three standards of care: chemotherapy, radiation, and surgery. Two of those three are known to cause cancer. So I've always scratched my head, David, when it comes to the standards of care for cancer. The whole goal of chemotherapy is to kill these cells before killing all the cells. You kill the tumor before you kill the patient. How's that working for us?
How is that working for us?
Chemotherapy, radiation, both we know can induce, we have to be careful, both can further cancer and lead to a much shorter life. Surgery, love the idea. If I have a 1-inch lump in my right breast, love the idea. And if you got to put a zipper on it, that's fine. Cut it out, send it off to the cancer lab, have it analyzed for cancer, send it also to a mycology lab, have it analyzed for fungus. Now you're going to get the truth. Sew that back up. When I come out of that local anesthetic, I'm cancer-free, unless it has metastasized through my body. I like that approach for cancer. Unfortunately, it's not used. Why we don't cut the tumor out and then test it? You see, we leave it in, and we put a needle in it. And if this is an ascomycete or a mycetoma, they're called, or sac fungus, and they look, for all intents and purposes, like a cancer tumor. But if you put a hole in it, you're liberating those ascospores, those fungal spores throughout the body, where metastasis could be possible. And to confirm that, about 5 years ago, the toenail fungus drug Sporanox, that only kills toenail fungus. It only kills fungus in our body. It's been repurposed now as an approved drug for cancer. If cancer isn't a fungus, how would a toenail fungus drug work for cancer? And there are so many threads that I could share with you, but I'm really looking at diabetes and many of these other diseases. By the way, always work with a competent doctor. But bring up the name Sporanox if you have cancer, because I've seen that be so helpful to so many people. And all it does is kill fungus, and it inhibits metastasis. The cancer tends not to metastasize in the presence of a toenail fungus drug.
I really like the way that you present your materials so that the viewers can actually do the math. Okay, we got this here, we got this here, that equals this here. It's very simple to understand, and the information is coming from medical professionals.
I'm referencing the scientific literature at all times. There were 3 or 4 women who had fine needle aspiration, FNA it's called, fine needle aspiration of the breast lumps. And these were women who were diagnosed with cancer. Then a doctor went in with a tiny 26 gauge needle, pulled out some of the liquid, sent it off to mycology on a petri dish, and it grew out fungus.
Wow.
I wonder if most breast cancers are fungus. See, what we do is take that lump and send it to cancer.
All right.
So they'll say yes or no. Mycology would say, well, after 2 weeks, it's growing a fuzz. It looks like, aspergillus mold, and you have more options.
Yes.
David, I have felt on my own, as the medical community castigated me as, I'm a big boy, I could take it,
Right.
thank God. But I have felt so alone. And now being able to help so many people by teaching doctors.
Yes.
When you give a patient a fish, he eats for a day. When you give a doctor the lesson of learning to fish, he can help all his patients. And that's what I think in my last few years here in this field, I think my goal is to teach doctors to offer options to their patients that they aren't aware of because they are not being taught this in their medical training.
And you're getting a good response at that.
So exciting.
Yes, yes. Well, I want to thank you again, Doug, for this time and for, once again, just sharing us and blessing us with your knowledge. All of the research, all of the effort you make into finding things out. I mean, you're constantly in the learning mode, even as even after all the years, you're still finding that. Yeah, I try to find a nice way to say it, right? Because we're getting older. We're getting older, right? But you're still a learner, and I think that that's a very important thing to note, because some of us become comfortable with what we know, and we think we're good right there, and we don't continue to pursue knowledge. This man continues to pursue knowledge. He's an example of what the results of that can be. And I'm very thankful, because all of your people, all of the people within your sphere of influence are blessed. I asked you this question yesterday, and we're going to close this out. Have you ever gotten anybody to actually say, and I'm talking about as far as the testimonials that you get, have you ever heard anybody complain about what you're teaching? Have you ever heard tell me about the feedback that you're getting over the years about all of the material that you're putting out. What kind of feedback are you getting?
If it comes from the medical community, there, and David, I understand that.
Okay.
If all you own is a hammer, then the whole world looks like a nail. If all you own is that degree that you owe $250,000 to a bank for, then you bought a bucket of antibiotics, a bucket of nails, and all they gave you was a hammer. As you begin broadening that perspective, you see the best doctors are those who got sick and couldn't prescribe themselves back into wellness.
Oh, Jesus.
Those are the best doctors in the world. They've had to go to their diet, they've had to look at omega-3 fatty acid and CoQ10 and vitamin C and natural IVs and juicing. They've had to do what you and I have to do.
Yes.
But unfortunately, about 95% of our doctors, their graduate diploma is a stop date. I love the doctor who listens to the patient and who uses that diploma as his or her start date. God's people are perishing for lack of knowledge by our doctors. If you're not taught the whole truth, a little bit of the truth.
Right.
Look, depression is not a selective serotonin reuptake inhibitor deficiency. I mean, it's amazing the way we take brilliant young men and women and re-socialize them into thinking that grandma was wrong. When she kissed their boom boom, when she rubbed a plant on their boom boom and it got better, by the time that child is 18, they believe they're on grandma's side. By the time they're in medical school, grandma was a quack. And that just breaks my heart, what's going on in medical training today.
I do see.
Go to a doctor, get to a doctor, use that valuable information as his or her opinion. If you have a serious disease that is life-threatening, let them be wrong. Don't let them be dead wrong.
There you have it. Brothers and sisters, I thank you for joining us on the Soulside Talk Show and being blessed by this man, Mr. Doug Kaufmann. I love you, Doug. You're
love
fantastic.
You too, love
you're
you
fantastic.
Too.
And
Thank
just keep letting God use you the way he does. I don't even have to really tell you that, but one of the things that we do know that you shall know the truth, and the truth shall make you free. Thank you for joining us on today. All right.